Okay. Let's see. Do I want to get started? All right. Welcome to GALME. Just let's see. Oh, here we go. There. Mission here is just to create an educational platform where interested students and healthcare professionals can explore and interact with wellness and emergency medicine in a variety of ways, and to showcase just kind of where you can take your own careers or inspire others to think abstractly here, and creating an international community of wellness medicine enthusiasts and experts committed to promoting a diverse and culturally competent environment. Let's see. We have a lot of future talks coming up, and website here, there's like all the past talks are recorded and like a list of all the future ones you can register for, and also like interact on social media for like more updates. And so today's speaker, you can join our mailing list. Biweekly lectures, wellness opportunities. We just had a pretty cool like wilderness first aid online course. And so more coming with that, fellowships, cases, conferences. So today's speaker, we have Daniel Grace, based in Brecon Beacons, where he works as a GP. Works for Nomad as a travel health physician, as trainee basics doctor, volunteering with MedServ Wales and Welsh Ambulance Service. Wellness medicine from the Royal College of Physicians and Surgeons of Glasgow, and the diploma in tropical medicine and hygiene from Liverpool School of Tropical Medicine, also a fellow of the RGS. Dan has worked on multiple endurance events and treks ranging from the tea plantations of Kenya to the deserts of Jordan, to the wilderness of Canadian Yukon. He also worked in Fiji with the World Extreme Medicine on the US reality TV show Survivor. I will hand it over to you here. Let's see if I stop sharing. If you want to bring up your PowerPoint.
Yeah, I will do. Thanks for that introduction and for the chance to speak. Let me just get my my screen up. Yeah, so no, it's really awesome to be able to give this talk. Yeah, it's nice to sort of, I completely agree with that whole sort of ethos of fostering a wellness community that's international and sort of shares their ideas and learning. So that's really cool. So yeah, I'm going to do a session on human factors on expeditions, which is an area that I'm quite interested in. So yeah, my name is Daniel. I'll just tell you a little bit about what I do, I guess. So I'm a GP, so family medicine doctor, probably to you guys, but I try and do as little of that as possible, because whilst it's interesting and it's obviously important to see patients, keep your clinical skills up to date, it's quite fun to sort of do a few other things. So that picture on the first slide, actually, I've just come back from the Yukon in Canada, working on an Arctic ultramarathon, which was good fun. This picture at the bottom here is the Yukon in the summer, the deserts of Jordan up here. This donkey was one of our ambulances. This was working in Fiji, the middle picture on Survivor. I do a bit of medical education and simulation, and also work as a travel health doctor as well. So expedition medicine, we spend a lot of time sort of learning about it, talking about it. We focus quite a lot on things like altitude illness, heat exhaustion, heat illnesses, cold, frostbite, hypothermia, tropical medicine, snake bites, sort of the sexy things like, pre-hospital trauma, what can go wrong. But actually, a lot of the times, it's people. So what about the people and the leaders and the teams that we work in, and the disagreements that we have, and the people that we get on with, or the people that maybe we don't get on with quite so well? And I think a lot of the time, as with sort of day-to-day life, that can often make or break an expedition, and it can sometimes be some of the biggest challenges that we face. Also, it's important to think how we deal with sort of crises and disasters, if that does occur on an expedition, and sort of an understanding of human factors and some of the ways we can improve the ways we work in teams and things like that, is useful, obviously, for our day-to-day jobs as clinicians, but equally so in the wilderness. Now, I know that this is it's a relatively small group, so I'm hoping we can try and be a bit interactive, although I know that's also sometimes a bit tricky, on Zoom and things. But we've probably all felt a bit like this at some point in our lives. I'd be lying if I said I hadn't. A bit like Homer Simpson operating the nuclear power plant. So I just want people, if they're able to, either to put in the chat or unmute themselves, turn their cameras on, and just say what they think human factors is, or what sort of words or phrases come to mind when I say human factors. Don't be shy. No one? All right, I'll put you out of your misery.
We have a couple in the chat here.
Oh, I can't see that.
All right, Harold, I'll read them out for you. We have interpersonal conflict, as well as human factors. It's how people interact with each other, how people are ready to deal with conflict and challenge. We have heuristics, more about how humans interact with each other and their impacts on the environment.
Oh, fantastic. Yeah, so I didn't see the chat. I've got it open now as well, actually. Yeah, so those are some really good points, actually. Certainly how we interact, how we deal with conflict. There's a few things about heuristic traps sort of a little bit later on. But yeah, equally the environments and the systems that we work in, because it's quite easy to focus on the human within human factors, which is obviously important, but a lot of it is the systems, the environment, and things like that as well. So if you were to sort of look at what the WHO would say, they say human factors examine the relationship between human beings and the systems with which they interact. So nice and simple. They say, it's focusing on improving efficiency, creativity, productivity, job satisfaction, and sort of minimizing errors. You might think, okay, that's all very well. What's that got to do with expedition medicine? But actually, if you're on an expedition and you want to foster, you're sort of setting up your own community. So you want to have all of those things going on, and particularly if you're on a long placement. So some people who might, overwinter in the Antarctic, for example, you need to have all these things working pretty well, because you're stuck with the same people for a rather long time, and you need to make sure things are sort of going smoothly. My friend in the military often puts it in a very simple way, and it's just optimizing people and processes to stop shit going wrong. So if there's one thing you need to remember, it's that. So for those of you who are sort of aware of human factors, a lot of it comes from the aviation industry. A lot of it sort of started back towards the end of World War II, when they were sort of looking at why errors happened. And then particularly in the 1970s, when there were a lot of commercial flights and also sadly several air disasters, there was a lot of focus on human factors and cockpit resource management to look at why problems were happening. And a particular example of this is an aviation disaster, as it shows on the screen here, which you may be familiar with back in 1972. So essentially a light came on in the cockpit of this aircraft, and the pilot and the rest of the crew were so focused on this light. They're like, why is this light coming on? Is it a problem with the landing gear? Is there something else going on? And then in the background, a warning tone started beeping. But no one actually noticed, and they kept looking at this light, and the aircraft was actually descending below where it should be, and then sadly crashed, and there was a substantial death toll. And that is quite translatable into healthcare as well. You can become quite task focused, you get tunnel vision looking at one particular thing, and that can similarly happen outside in the wilderness as well. So these figures are for the UK. I suspect they're similar in the US as well. Essentially, we make a lot of mistakes. There are avoidable hospital deaths, serious incidents that are sort of near misses, and a lot of medication errors. And in the UK, there's a particularly well-known case of a lady called Elaine Bromley, who sadly passed away. And she went in for a routine sinus operation as a day case, an elective procedure. So no one should really die in a low-risk day case procedure. And what happened essentially is that she found herself in a can't intubate, can't ventilate situation. And she had a consultant anaesthetist there and an ENT surgeon. So two people who you'd want to be there if there was an airway problem. You know, like, these are the guys we want. And what happened was they kept trying to intubate her, and they kept trying. And the nursing staff went and got the surgical airways kit to try and get front of neck access. And they put it in the room, but nothing happened. They kept trying to intubate. They kept trying to intubate. And eventually, I think eventually they may have sort of gone down the route of doing an emergency tracheostomy, but it was too late, unfortunately. And after a period of time in intensive care, this lady sadly died. And this is just a particularly, I suppose, poignant example. I'm sure there are many more, and you may have come across similar as well. But the husband of Elaine, so a chap called Martin Bromley, he's a pilot, and so he came from that world of human factors. And rather than sort of try and point blame, he was just very interested in sort of working out, well, why did this happen? Was it to do with the hierarchy within the anesthetics room? Did everyone sort of perceive certain people as experts? Were the nurses who brought the kit to sort of afraid to speak up in case they were sort of, making assumptions or thinking the wrong thing? Or was it task focused? Was it, like in that cockpit, were they just focusing on a certain thing? A lot of the debrief after the event was that we didn't know how much time had passed, or we hadn't thought about a certain sort of thing within that situation. And a lot of it comes down to communication as well. And we'll sort of look into some of those factors and their relevance shortly. So a nice way of remembering human factors is to think of the animal, the sheep. So this is a really good book. It's written by a UK-based anaesthetist called Debbie Rosenau-Lang. And essentially, SHEEP is the acronym. And we covered most of these, I think. So the systems. So I'm sure you can all think of a system that you work in. In the UK, it's the NHS. In other countries, it's different healthcare systems, and you can think of certain things that you probably see day to day that could be better. Then there's human interaction, so how we interact with each other. Obviously, that can make or break any situation. The environment that we're in, so I suppose in the wilderness expedition context, it's going to probably be somewhere that's hot, cold, dusty, probably dark. What equipment have we got? Is it working? And what personal baggage are we bringing? And I suppose by that, if you're thinking that you're on an expedition, you've probably walked as far as all the participants. You may be tired, you may be hungry, and there's all that to factor in. And like many of these situations, it's like a piece of cheese. So you may be aware of the Swiss cheese model. So usually if just one of these things happens, you kind of can, it shouldn't really happen, but you might get away with it. But when enough factors align, that's when the problems can happen. And you might think, okay, this is all very interesting, but what about expeditions? So let's think of that Swiss cheese model and go to Africa. So we're working on an expedition in Africa, and the flight is 4 hours late. Which happens, doesn't it? Flights get delayed, you can miss your connections, all sorts. But the driver who was going to pick you up from the airport, he's been awake since 5 a.m. He's been working on other jobs. It's now 8 in the evening. And you've still got 4 hours to drive to your camp. And he's tired, you're tired. He knows he needs to get you to the camp because he's got to get back to the city and do another job early that morning, the following morning. So he's driving quicker than usual. You're tired because your flight, you know what it's like when you're traveling. So you don't quite notice, you're not so, you're not paying so much attention to checking the vehicle. You don't notice that actually the tread on his tires is pretty much bald and actually his tires need replacing. And your flight was actually delayed because the weather wasn't so good. And there's actually been quite heavy rain and the road is not in the best state. And then halfway through the journey, you skid off the road, you get a blowout of your tire, branches smash through windows, and you potentially have multiple casualties. So that's just an example to sort of illustrate, I suppose, where we could have maybe acted differently, and having that awareness can help with that. So I just want us to quickly zoom out and have a little bit of a think about hazards and risks, because they're quite important, well, in life, but also on expeditions. So a hazard is obviously something with the potential to cause harm. So in that situation, it's the driving on the road. The risk is the chance you'll be harmed. So in that case, it was driving on bad tires on bad roads, being driven by someone who's too tired and you didn't have the chance to sort of make that assessment. I quite like this one, that the hazard is shaving your face, but the risk is much higher if you shave bare. Anyhow, so that's just something that's quite important to consider. But a lot of this also comes down to having that situational awareness and having that bandwidth. So if you are tired and you're in that situation, it can be really hard to sort of have that whole kind of zoomed out view. Some of you might have seen this before, but I just want to share this video with you. You should hopefully get the sound, and it should tell you what you have to do if it plays. Hang on. Oh no, don't tell me it's not going to work. It's not going to work. How annoying. Let me just try one more time. Okay, never mind. It's a good video. I'll put it in the chat if I can. Essentially, you may have seen there's several different ones sort of circulating. Essentially, people will be doing something. You have to focus on what they're doing, and then something else happens. And it's to illustrate that you can just get so task focused and to get that tunnel vision. And that can really easily happen if you're out on an expedition. So say you're at the back of, say you're on a hiking trip and you're walking, I don't know, to Everest Base Camp or something like that. And you're walking, you're really enjoying the views, taking lots of pictures, walking sort of with a group of people in the middle of the group. And then someone at the back can be really tired. Maybe they're starting to get altitude illness, and you don't notice until they actually get a bit dizzy, fall over, and potentially fall, off the track and injure themselves. And it's surprisingly easy to lose situational awareness, like this man sitting on this branch. And that kind of comes back a bit to some of the things I was saying about the can't intubate, can't ventilate case. All the feedback and all debriefs in these sort of situations, it's always, I wasn't aware, I didn't notice. You may have experienced it yourself. I've certainly experienced it. And it's having that ability to zoom out, I suppose, and have what we call the helicopter view. So, be above the situation if you want to imagine that you're kind of looking down. A good thing from some of my colleagues is the concept of 10 seconds for 10 minutes. So say you're dealing with an emergency, and this can be in the hospital, it can be on an expedition. It gets very stressful and you need to just pause and have a timeout. And 10 seconds for 10 minutes essentially is right. In these 10 seconds, I'm going to share my mental model with everyone else around me and tell them what I need to achieve and what this patient needs within 10 minutes. So it may be this patient has a pelvic fracture, they are hypotensive, we need to get them to X location and arrange a helicopter evacuation or something like that. And doing things like that, and then saying at the end, does everyone understand? Is there anything I'm missing? Is also really good for sort of flattening hierarchies as well. And situational awareness it's good if you're at level 1, but it's even better if you get to level 3. And what I mean by that is that if you have the awareness but don't actually understand the significance of it, then it's less useful. So the example here is obviously someone who looks cyanotic and is not breathing. You have to understand the implications of that and then work out, okay, I need to do this because otherwise he's going to get worse. And a lot of this comes down to bandwidth. So you're like a bucket. You've only got a certain amount of space. Some of it will be what's going on inside your head. Some of it's the task that you've got to do. And the sizes of these amounts of water will vary depending on how competent and familiar you are with whatever the task is and with whatever the context is, so the environment that you're in. This is quite a nice curve that sort of illustrates that. So we have an optimum arousal level, and depending on how that is, we will either be stressed or we will thrive. So yeah, obviously, if we are not aroused enough, we'll be bored. If we're too aroused, we'll be stressed. So we want to be in the middle, right? It's not rocket science. However, I'm just going to skip that slide just because I've rehashed it and they're slightly in the wrong order. So let me just go across to this one. So this is an expansion on that previous slide, really. So along the vertical axis, we have challenge, and along the bottom, we have skill. And what you want to ideally be is to be in this flow state where you're managing a highly challenging situation, but you've got the skills to be able to deal with it. And a lot of the time at work, you can be in this sort of apathetic boredom sort of area, you know, if you're doing something that's not particularly difficult or challenging. If it's very challenging and you don't quite have the skills, it's more sort of this anxious type state. So you want to get into this flow state here. Now, having a think about stress versus stresses is quite interesting. Stress is obviously something, it's the physical or the psychological response, and the stressor is the thing that causes it. But a lot of the consequences are because of the impact it has. So if we can then acknowledge that we have stress and that we are being influenced by something that is stressful, if we can completely change that impact or slightly reprogram it, then we can hopefully work out how to get into that flow state. There's quite a good sort of method here. You have to say this like Mr. T from the A-Team. I'm not going to, but some of the sort of things that you can do is, so it's beat the stress full, so breathe. And that sounds really basic, but actually by taking deep breaths in and out, you actually increase your vagal tone, which will then reduce your heart rate. So there is actually some physiology behind it. Talking to yourself. Now, some people might say that that's a sign of insanity. However, actually talking to yourself, so saying, okay, there's a collapsed patient on the floor, and you might do this in your head, you might do it out loud. Okay, I can do this. I know what I have to do. I've practiced this. I've seen patients like this before. I need to do X, Y, Z. And sometimes if you know that you're going to then have to do a procedure, for example, so say, I don't know, say you've got to cannulate someone on the side of a hill, you sort of mentally rehearse that. And then you can, because at this point there's so much other things going on, you can bring your focus back and have a trigger word. Interestingly, I was reading a paper about this sort of a few days ago. They used the example smooth. So the person just said that to themselves, which I thought was a bit strange, but whatever word works. And it doesn't really matter what the word is, because it's the association with then you're in that zone and you can do what you need to do, which I think is quite interesting. Other ways of combating stress, obviously on expeditions, some of these might be a bit difficult, but it's still important to think about. Obviously sleep if you can, but checklists. So many people seem to think that checklists are a sign of weakness, but they're not. They're so useful. So having a checklist, whether that's for your patient handover to the helicopter medical services, whether that's just for your primary survey or something as simple as that. Actually, if any way that you can improve your bandwidth and help with that stress in that situation is useful. yeah, avoid contributory factors, obviously, but so make sure you're eating and drinking. Don't get hangry. Being hangry is quite common on an expedition, so you need to sort of be aware of that and have that self-awareness. We will come back to psychological safety a little bit later. So one thing that is particularly useful, actually, is to try and share your mental model. So like all these penguins who've got this shared mental idea that this is the perfect fish, having a shared mental model is particularly useful. And it depends obviously a bit on the expedition. So if you're the only medic on the trip, you might think, well, what's the point in sharing my mental model? But actually, expedition leaders tend to be first aid qualified. They, if it's someone who's working at altitude, the chances are they'll have seen common altitude illnesses before. And you may be on an expedition with several different clinicians as well. But just sharing what you think, why you think it, and also offering people the opportunity to potentially challenge that within reason is really, really valuable. And that links quite nicely with some of the other things that we were speaking about there. But you can't really share your mental model or do any of these things without being able to communicate efficiently. So we're just going to have a bit of a think about that. I really hope this next video works. We will try it. Some of you might have seen this before. Oh, come on. I checked these videos beforehand. I don't know why they're not working. Let me just try that link instead. Sorry, bear with me.
Das hier ist mein Sektor. Das hier ist...
Okay, so this, you may have seen it before, but it is a good one. Hopefully you can hear it.
Das hier ist mein Sektor. Das hier ist das wichtigste Gerät des Küstenwächters. Das Gerät und das Gerät. Überlebensradar.
Mayday, Mayday. Hello, can you hear us? Can you hear us? Can you... Over. We are sinking. We are sinking.
Hello? This is the German Coast Guard.
We are sinking. We're sinking.
What are you thinking about?
I think that's a good one. Hopefully you got the sound coming through. But yeah, it's obviously and apologies to anyone who is German or has German ancestry. It's all in jest. But yeah, communication is sort of the most important thing in life, really, but particularly out on expeditions. Has anyone got any, apart from maybe speaking different languages, any thoughts on what makes good or what makes bad communication? I've got the chat open now, so you can put any ideas in there if you like. So yeah, got some things coming in. So open-minded, receptive to feedback, being direct, understanding cultural differences, making space for others to talk, not just your own ideas, even if you're in charge. Yeah, that's really important. Avoiding jargon. Yeah, that's very important as well, particularly if someone is using technical medical jargon or technical mountaineering jargon or something like that. Clarity and conciseness, closed loop communication, listening skills, and knowing when to sit down and shut up. Yeah, very good. No open-ended questions. I don't know, sometimes open-ended questions are good. I suppose it depends on what you're trying to achieve. Cool. Let's see if we got them all. Yeah, so I guess this is a negative slide, isn't it? Because it just says barriers. But yeah, we've covered some of the really good things. I guess some of the barriers we've sort of touched on, and I suppose these are the barriers to effective communication. But it's when people are sort of under stress, time constraints, if they're having psychological trauma. Sometimes, I think someone mentioned cultural awareness, but people from different cultures potentially, I mean, it shouldn't be a reason why people can't communicate, but sometimes it can pose challenges. And having that appreciation is really important. Someone mentioned closed loop communication. Super important, because actually, if I am saying something to you, and I know what I mean because I'm saying it, but if actually you've understood it and you think it means something different, if you don't tell me that, I have no idea. Then you go away and do whatever task that I've asked you to do and come back having done something completely different. And that's not ideal. So I guess this is a sort of a picture that sort of explains that, just for people who don't know about closed loop communication. I guess the clue is sort of in the name. So you say something to someone, you want them to then confirm what you've said, what they're going to do it, and then they will come back. What it says here about coding and decoding gets a bit technical, but the main thing is that, you know, when we're in a stressful situation, we've got so much internal noise that this bit can often get quite affected. And it is just worth remembering the simple things when it comes to communication. These are just some checklists. They are used in the UK, and I suspect you've probably got similar ones or maybe the same ones. Nothing wrong with checklists. They improve our ability to do things correctly in stressful situations. Now, someone said heuristics. So I quite like this quotation from a chap who mainly studies avalanches and why people get avalanched. And I think this is probably the same in all walks of life, really. But even though people are capable of making decisions in a thorough and methodical way, it appears most of the time they just don't. So that's quite interesting. Everyone hopefully knows who this is. It's Admiral Akbar, of course, and it's a trap. So we're going to have a little think about heuristic traps. And so these are basically problems that exist within our own minds or brains, mistakes that we make over and over again. They are common in many different things, but obviously on an expedition, they can be quite dangerous. And it's interesting because as we go through them, I can certainly think of some of the ones that I've fallen into before. So the expert halo. So that's sort of the assumption that, you know, say you're going on a trip and there's a guide or there's a lead medic or whoever. They're the expert. They've done all the exams. They've got the T-shirt, the certificate, everything. They must know what they're doing. Who am I to question that? And you know, some of the time that's true, but I guess it's always worth being slightly dubious. So having that ability to risk assess and sort of think outside of someone else's assessment is quite important. But it can feel quite uncomfortable, particularly if there's an age gap or an experience gap. It's hard, particularly you don't want to be that one person in the group who's like, I don't think we should be going here, and everyone else is like, oh, shut up, you're just trying to ruin it for us. But actually, if ruining it means turning around and actually having the insight that it's not safe to do it on that day, then that's obviously the right thing to do. Familiarity. So this is when we're sort of thinking, well, I've done this lots of times before, so it's probably going to be fine. Well, it probably will be, but you know, it might not be. So yeah, the example here is, you know, you could have worked on a particular expedition a few times and it was fine, so it'll be fine next time, but obviously it won't necessarily be. The one that's particularly interesting, I think, is social proofing. So it's okay because everyone else is doing it, so I'll probably be okay. And that's one that I think a lot of us probably fall into. And I think, I mean, social is in there, but it links a bit to sort of social media as well, doesn't it? I think now everyone sees people doing the same thing and they share all their photos and videos of it. And then so everyone goes out and does it and potentially gets into difficulty. Commitment is quite a big one. And it fits a bit with the next one as well. So basically, you know, you don't have that much time. You've committed to do something. And you want to do it because you've already decided and you're sort of imagining that time on the summit. And even though you're not maybe keeping up to the pace you wanted to, actually, you've got that sort of bias in your mind, and particularly if your group has that same bias. So obviously, depending on if it's an individual or a group sort of feeling, then that can play a big role. You ideally want one person in the group to say, hang on guys, actually, let's do a reality check here. And that fits a bit with scarcity as well. So, you know, and this can be a challenge, particularly when you're working on an expedition and you as the medic are having to turn someone around from summiting or tell someone who's doing an endurance event that actually they probably shouldn't continue. And because we perceive, maybe rightly or wrongly, that the opportunities to do certain things are a bit limited. And that may be because you don't have enough annual leave, or it might be that you've spent a lot of money on a trip, or someone has, a participant has spent a lot of money. And therefore there are a lot of biases that are at play there. So just having that awareness of these common traps is quite useful. This came out, I can't remember the name of the document, I apologize, but it came out sort of earlier this year, and essentially how people get into difficulty in the mountains. I think this was looking at accidents in the Swiss Alps, but essentially, you know, loss of vigilance. So you're getting focused on different things. So you're, you know, that bandwidth that we're talking about. Expert halo. So the assessment was left to the leader. Social proofing, that familiarity bias, pressure to achieve the goal. And that can all add up and cause sort of a critical situation. So we sort of had a bit of a think about, you know, you don't want to be that person who causes a problem for your team or for your group. And similarly, as the expedition medic, you're going to have to exist within a team, whether that's a team of other medics, whether that's a sort of an expedition leadership team, or just a team with the participants, because you're going to be together often for at least a week, sometimes months. It depends a lot on the type of trip that you're doing. So you may be familiar with this. I'm not sure if you are or not. It's quite well known. It's sort of the process that teams go through when a new bunch of people come together. So they form, storm, norm, and perform. So forming is when, you know, the clue's in the name, when the team sort of forms itself and people come together, you're sort of working out, you're like, oh, hi, I'm Daniel, and you're kind of working out, okay, who are the people in this team who are going to be sort of the alphas, who are going to be the other sorts of people, and you start storming and working that all out. The storming is when you sort of think, no, actually, you know what, don't like that chap over there, he's kind of winding me up a bit, and the team may become a little bit dysfunctional. Then actually you kind of settle your differences, which is the norming stage. And then most teams will then hopefully perform. And that's when you're working efficiently and effectively as a team. There's a stage after this actually, which isn't on this diagram, which is sort of after the expedition or after the team is disbanded, if you like, called adjourning, where people sort of actually miss that team working. But this is quite an interesting one to think about if we think back to sort of the earlier part of the talk about that case I was saying with the can't intubate, can't ventilate, and then think about how we might risk assess for an expedition when looking at human factors. Because like we said, it's not just human. Obviously, the human bit we can try and control, so particularly if we've got an insight. But a lot of it is the systems or the equipment, as you can see here, the software or the hardware or the environment. And obviously it's not a working environment, it's an expedition environment, but the principles are sort of still the same. And do we actually have a good atmosphere between the leadership team or between the participants, and how can we optimize that? And how do all these things come together and affect individuals? And one of the interesting things to think about is how you exist. So coming back to the human part of that, how do you exist within a team? And I'd like you to try and think about this as I go through these different boxes, where you think you might be, or how you would be if you were sort of out on an expedition. So some people will be passive, which is fine. But it can be difficult to obviously get your points across sometimes, and others' rights and needs will probably take precedence over yours. Hopefully you're not passive aggressive. That's where obviously everyone has probably experienced someone like this, where you sort of subtly make clear that you're kind of right, and your needs are the most important, but you kind of don't really do much about it necessarily. You get people who are aggressive. So everyone's probably met someone who's in a position of power or a leader who behaves like this, and they need to get their point across because it's the most important thing. I wonder how people think these three types would react and lead a team in a disaster or a crisis. They probably would manage it, but it might be a tricky team to work in. And I guess the point I'm trying to make is that you can be assertive, and you should aim to be assertive but not aggressive. And you can get your point across without being aggressive, passive aggressive, and you can sort of express what you need to say without being sort of difficult about things. So what happens if you're out on an expedition and you are faced with this aggressive person? Let's say that actually your expedition leader, unfortunately, falls into this red category. And you have a situation where they are trying to do one thing and you think, actually, this isn't safe. We should not be doing this. How are we going to challenge that? And that can happen in healthcare. There's plenty of cases, and you could find the person wasn't aggressive, but you could reflect some of this back to that case with the anaesthetist, the can't intubate, can't ventilate. How do you challenge someone who is clearly not doing the right thing in a hierarchical system? We'll just skip this one because it sort of repeats it on this slide. But this is quite a nice way of doing it. So the CUS tool, so this comes from the Royal College of Pediatrics in the UK. I'm sure other colleges have similar things, but essentially it's an escalation concept. So to start off by saying, you know, I'm concerned about X, Y, Z. And then if nothing happens, you say, actually, I'm uncomfortable with this. And then you have to become more assertive. I'm sorry, this is unsafe. And then ultimately you have to tell people to stop. But actually having that logical way of escalating things rather than just panicking and potentially either being passive aggressive or aggressive is quite useful. And the reason we don't want to be aggressive is because aggression in healthcare has very poor outcomes for patients. This is a slide from someone called Dr. Chris Turner, who is an A&E consultant, and he looks at incivility, so whether people are civil to each other or not, essentially, and it doesn't project amazingly well, so I apologize for that. But if someone is incivil to me, and that doesn't have to be in the hospital, it can be out on an expedition, there's a 61% reduction in my cognitive ability, which is huge. And if all the participants of the expedition or some other leaders are around me, there's on average a 20% reduction in their cognitive ability, which is amazing. And I think it's something that it's really easy to address. And it is it's one of those things that can actually make a huge difference, particularly on expeditions as well as in hospitals. And I alluded to this earlier, and it links a bit with this as well. But out on the expedition, or in your team back in practice as well, it's really important to try and create a psychologically safe environment. And what I mean by that is that it's a safe place to take risk. And I don't mean risk as in sort of physical risk. I mean, sort of personal risk. So actually being able to talk to people about how you're feeling or getting feedback where you're not going to be destroyed, asking questions, having a safe discussion. Because a lot of the time, people don't actually say what they think, what they feel, or anything like that, because they don't want to be embarrassed, they don't want to be rejected. And creating that environment, particularly on an expedition, can be so valuable. And one of the things that we sometimes do on youth development expeditions is have like a morning or an evening check-in where everyone can say, you know, this is a safe place. how is everyone feeling? What's actually going on? What are people thinking? And actually, that can be huge because it allows you to sort of flatten hierarchies. People actually talk and are civil to each other, and it actually improves a lot of outcomes. We're getting towards the end just because I am conscious of time and the fact that we need to have a sort of a question bit at the end. But I just briefly want to, I'm just going to skip a few slides, but I just want to touch on two other things that I think are quite important. I apologize for bringing up resilience. It's kind of the buzzword. It's probably been flogged to death a little bit, but actually it is important. And I say this for a few reasons, in that, touch wood, you go on an expedition, you don't have to use very much from your medical kit and everyone comes home and is okay. But there is always the risk of something adverse happening. And I guess one of the challenges with going on an expedition is that you are in the middle of nowhere relative to where you'd be normally. You don't have a hospital in your rucksack, unfortunately. So if things happen, whether that's trauma, cardiac arrest, the risks are still low of these things happening. But if they happen, it's going to be harder to actually have a successful outcome. And people know this when they're going out on an expedition. But being able to have that resilience and that ability to also talk to your team about this is really valuable, because if you're not going to have that, then there's risks of things like PTSD and longer term sort of mental health problems. Even on a sort of a smaller level, it's about taking those, thinking back to that slide on stresses and impact. It's trying to reframe these things as challenges rather than threats, and trying to sort of reappraise things. And this might not be something that you're doing in sort of hours, days, weeks. This might be sort of months and years later, depending on what the actual situation we're talking about is. But trying to find the positives out of stressful or potentially traumatic situations as well. And that just links into the last thing really, which is moral injury. So no one really goes on an expedition such as this expecting something sort of disastrous to happen. And moral injury was a term that has been around for a while, but it became particularly relevant during the pandemic because people would go to work, witness huge amounts of suffering and mortality. And the distress that sort of results from that, it sort of violates your moral or ethical code, really. And people will get all of these things. And it can happen, like I'm saying, on an expedition. I think with a lot of these things, the importance is really recognizing the red flags, having that ability to debrief. As the expedition medic, you have to be a bit careful because you don't want participants to sort of cling to you once you've gone home, as it were, in that you have a responsibility and a duty of care, but you also don't want to take on too much of a burden. You need to be able to signpost people back to their own physicians or GPs as well. So we're coming to the end now, really. So it's been a bit of a whistle-stop tour around various aspects of human factors. I think in summary, the kind of the main things to remember are human factors aren't just about humans. It's about systems, it's about environments, it's about humans, equipment, but also all that personal baggage that we have as well. And if we have an insight into that, we can hopefully become much better people, much better expedition medics. And I hope you found that interesting. I just want to end with this quote, which I think sums up the talk quite nicely. So every human is like all other humans, some other humans, and no other human. So that is a quotation by Clyde Lockhorn, who was an American anthropologist who worked with the Navajo Indians. I don't think I said that properly, but yeah, I think that's pretty interesting. So I hope you found that informative, and if anyone has any questions, I'd be happy to take them.
Thank you so much, Dr. Grace. That was excellent talk. I think human factors, at least for me, is one of the big draws to wilderness medicine in general. There's just so many variables at play. So folks, if you have to take off, no problem, but we do have some time for some questions and answers. So you're welcome to drop them in the chat. Or if you'd like to breach your anonymity, you can raise your hand and we can call on you. I have a question for you, Dr. Grace. I see on your website, by the way, which is another excellent resource that people can check out, the wildernessmedic.com, I believe. You've done quite a lot of really awesome things in the wilderness medicine industry, including some work with media. I'm wondering if there's any unique patterns working with the media that you've noticed in the context of human factors.
Yeah, thanks for the website plug. Yeah, no, that's a really good question. I think, I guess the main thing is probably that, and this comes, I suppose, with not necessarily just media trips, it's always that you as the medic have a certain agenda, basically, to keep people safe, make sure people don't hurt themselves. I think the media side of things is potentially, to get good TV or films or whatever people want to watch. Risk has to be involved because otherwise it's boring and people won't watch it. And it's working out, I guess, how you have a successful relationship between those two things, because you don't want, if you're going to be the person who's like, no, you can't do that. No, you can't do that. And then people are just going to be like, well, can we do anything? What's the point in whatever production we're making? So I guess it comes down to having those open discussions and sort of trying to come to some sort of compromises. But those are probably the main challenges, I think. But you can equally have that on a non-media expedition as well, I think. Yeah, does that sort of answer your question?
Yeah. All right, any other questions, anyone? Dr. Grace has done some really interesting things. I saw you were a medic across Britain a couple of years ago. Here we go. Out of curiosity, where in the Yukon were you working?
Oh yeah, so the Yukon, well, so the first time, which was in 2019, and in the summertime, we flew into Whitehorse, and then we went up to near Mayo and sort of wild camped and trekked in the wilderness for sort of 4 or 5 weeks. That was a youth development trip. And then about two weeks ago, I just came back. Again, we flew into Whitehorse, and it was supporting this Arctic Ultra that went from Whitehorse up to Dawson City. So people were trekking they could either do 100, 300, or 430 miles. Mad people, but fair play to them. It was an amazing effort. It's good to support. There's some other questions I can see in the chat as well. Do I have any instances in my career where human factors became an issue? Yes, so many. I think they become, well, I think human factors, they follow you everywhere, don't they? I think, yeah, there's certainly, I think the main thing on most expeditions is it always comes down to how you are in teams. I think a lot of the time the medicine is, not to say easy, but a lot of it is preventative. Risk assessments, planning beforehand, identifying problems early, managing them. I think sometimes, yeah, I think like in all situations, if you're with people in an enclosed space, you're seeing them all the time. Sometimes people are going to get annoyed with each other. You see that the human factors are always the most important thing, in my opinion. Yeah, I won't share any examples because I could be here for a long time, but yeah. Any tools that I've personally found useful on expedition to manage a situation? I think the 10 seconds for 10 minutes, if I could recommend one tool, is probably the best thing and it doesn't just have to be used in expeditions. Anytime that you're feeling that internal noise in your mind is getting too much in a stressful situation, whether that's medical or otherwise, whether you're on your own or whether you're in a team, I think that's probably one of the most useful ones. The next question, when did you first get involved in wilderness medicine? Actually, so I did all my training to be a GP, and then I decided I didn't want to spend the whole time in the consultation room, and I thought, what else can I do? So that's when I got involved with it. So back in 2017, 2018.
All right, that looks like that's all of our questions. Last chance here. Yeah, in the meantime, I guess, Dr. Grace, just to close up here and let you get on with your night, since it is pretty. Oh, one more. How do you get involved in ultra races? I'm also really interested in this.
Yeah, I guess getting involved in anything is, I'd say, and I recognize a few names on the call as well. I'm sure they'd also say similar things. It's just being persistent, really. You just have to find companies online. Do they advertise? Sometimes, but it's usually a case of just emailing people, asking, and if they don't email you back, email them again, and just keep hassling people. I think if you make a nuisance of yourself enough, they'll either really never email you back, or they will eventually. But yeah, I think just persistence. The other thing I'd say is that if something seems like it's if someone's asking you to do something and it's maybe not quite what you want to do, but it sounds like it could be quite interesting, always say yes within reason, obviously, just because it may open doors that you then think, oh, actually, I'm glad I said yes to that, because it's actually allowed me to have that next opportunity that leads on from it. Yeah, Gemma agrees exactly. And Tony wants to know, if I could take one piece of kit, what would I take on an expedition? He's the only one who's going to understand this, but it would be my cutlery. I know, Tony. Tony, do you want to unmute yourself and tell us why that is? No. No, he doesn't.
I mean, my cutlery only just makes it around the world with me, so it's not made it back to the UK from Canada. Still, it's on a conveyor belt somewhere in an airport.
Tony was in the Yukon with me. This is why. But yeah, in terms of medical kit, or kit in general, that's a good one. I don't know, actually. If I could just take one piece of kit, probably a good sleeping bag.
All right, I guess we'll call it there. It looks like Hannah also recommends a spare spork. So keep that in mind, everyone. So with that, I think we're going to wrap things up here. Dr. Grace, thank you again so much for donating an hour of your time to our group here. We really appreciate it. It's really nice to learn about all these opportunities ahead of us. So folks, with that, we're going to wrap things up. Stay tuned. We have a talk in 2 weeks. And look out for more emails from Gomi. Thank you all.
Awesome. Thanks a lot, guys.